She had 40 seconds before the Marine died. The monitors were screaming. The resident was frozen. And the charge nurse was screaming at Emily Carter to step back and wait for someone qualified to handle it. 40 seconds. Emily had worked in conditions where she had 30, where the person on the table wasn't in a sterile ICU, but bleeding into the sand with enemy fire cracking overhead and no one coming. She stepped forward anyway. Not because she wanted recognition, not because she needed to prove something, because the young man on that table was 22 years old and his heart had stopped, and she was the only person in that room who had ever brought someone back from that particular edge. And she had done it 11 times before anyone in this hospital had ever handed her a mop. Before you find out what happened next, if you've ever been underestimated, overlooked, or treated like you were invisible, this story was made for you. Drop a comment with the city you're watching from. I want to see how far this reaches. Hit like, follow along, because what happens in that ICU is only the beginning. Ironwood Medical Center sat on the eastern edge of Denver like a concrete promise nobody intended to keep. 14 floors, 432 beds, a trauma wing that had won regional awards 3 years in a row, and a staff culture that functioned on a precise and well-maintained hierarchy of cruelty. At the bottom of that hierarchy, without dispute, was Emily Carter. She was 31. Medium height, unremarkable build, the kind of face that people looked past rather than at. She wore her dark hair pulled back so tight it looked almost aggressive, and she moved through the ICU with the particular economy of someone who had learned a long time ago not to waste motion. She didn't chat at the nurse's station. She didn't linger over coffee. She arrived 7 minutes before her shift, completed her handoffs in full, and stayed until her replacement had actually read every chart. Not skimmed them, read them, before she would leave. None of that earned her any points. Charge nurse Nicole Parker had made her assessment of Emily Carter within the first week of Emily's hire, 14 months ago, and had not revised it once. Nicole was 44, with the kind of institutional confidence that comes from spending 2 decades in a single building and learning exactly which walls to lean against. She wore her authority lightly in front of hospital administration and like a blunt instrument everywhere else. Carter. Nicole's voice had a specific pitch she used for staff she'd already dismissed. It wasn't angry, it was worse. It was patient, the way you'd speak to someone who kept making the same mistake. The bed in Bay 6 hasn't been turned over. The family in Bay 9 needs the attending paged, not you. And whoever left those supply carts in the hallway, that was from the overnight shift, Emily said. I didn't ask who left them. I asked for them to be moved. Emily moved them. She moved them the same way she did everything. Without argument, without visible resentment, without the kind of pointed silence that might be interpreted as attitude. She had learned, a long time ago, that visible anger was a luxury. It cost you positioning, it cost you access. And Emily Carter was, above most things, a person who understood the value of access. Dr. Victor Kane was the trauma chief, and he had formed his opinion of Emily differently than Nicole had. Not through observation, but through a single conversation, 6 weeks into her employment, when she had flagged a medication error in one of his residents' orders. He had checked the chart, found she was correct, corrected the order without comment, and then spent the remaining year and 2 months making sure she understood the cost of embarrassing him. It was subtle, not the kind of thing you could report. She was assigned the most exhausting beds, the patients who required the most turning, the most monitoring, the most emotional labor for the least clinical complexity. When she raised concerns and handoffs, they were noted and then set aside. When a difficult family needed managing, she was the one sent in. She went. Every time. There was a resident named Ryan Foster who sometimes noticed. He was 28, in his second year, still carrying that particular anxiety of someone who hadn't yet learned to fake confidence. He'd catch Emily doing something, repositioning a patient's airway with a precision that didn't match the rest of her job description, or catching a subtle pressure drop before the monitors registered it, and he'd get a look on his face like he was trying to solve something. Once, in November, he'd said, "You've done this kind of thing before, not here." Emily had handed him the chart she was holding and said, "You've got a potassium issue in Bay 4. He'd let it go, Shimshon. The Marine came in on a Tuesday at 11:47 p.m. His name was Corporal Damon Reyes, 22 years old, active duty, stationed at Fort Garland, 3 hours south of Denver. He had been the passenger in a vehicle that had been struck by a semi that ran a red light on I-25 at approximately 90 miles per hour. The driver had died at the scene. Damon Reyes had not died at the scene, which was, according to the paramedics who brought him in, a statistical improbability. Emily was the receiving nurse. She saw the mechanism of injury before the paramedics finished their handoff and started her assessment while they were still talking. Blunt thoracic trauma, left chest wall instability. She could see it in the way he was breathing, the asymmetry of the rise and fall, the way he was guarding without knowing he was guarding. His blood pressure was holding, but it was holding wrong, compensating in the way that precedes a cliff. "He needs a chest film and a fast echo," she said. "Now, not in 5 minutes." The paramedic who'd been doing the verbal handoff paused mid-sentence. "We're not done with report. You can finish it while we move." She was already adjusting his oxygen, repositioning the mask. "What's his GCS been in transit?" 14 on scene, fluctuating. Fluctuating how? Down to 12 twice, back up. She flagged Ryan Foster, who was the resident on for the night, and he came over still holding a half-eaten granola bar, which he put in his coat pocket with the focused awkwardness of someone trying to look more composed than they felt. "Blunt thoracic," Emily said. "Left-sided, tension developing. We need imaging now, and I want a crash cart staged." Ryan looked at the patient. "He's maintaining. He's compensating. There's a difference." Ryan hesitated. Not because he disagreed, she thought, but because he was running the calculation of what it would cost him to push for resources based on a nurse's read. Then he ordered the film. The chest x-ray came back in 9 minutes. Left-sided pneumothorax, not yet tension, but the trajectory was clear to Emily before the radiologist called it. Dr. Kane arrived at midnight, not because he'd been called in, but because he was doing late rounds on a patient 2 floors down and had gotten the notification that a trauma case had come up. He looked at the film, looked at Damon Reyes, and said, "We'll monitor. He's stable." "He won't be stable in 30 minutes, Emily said. Kane didn't look at her. "Thank you, Nurse Carter." That was the dismissal. Everyone in earshot understood it. Emily went back to her charting. She kept her eye on the monitors. At 12:49 a.m., Corporal Damon Reyes went into cardiac arrest. The tension pneumothorax had progressed exactly the way she'd known it would. The air had accumulated, the pressure had built, and the heart had run out of room. The monitor alarm triggered, and the ICU went from quiet to controlled chaos in about 4 seconds. Ryan Foster was first through the curtain. He stopped at the bedside, and Emily watched his hands. They didn't move. He was looking at the monitor, then at the patient, then at the monitor, doing the cognitive translation between what he was seeing and what to do about it, and the translation was taking too long. "Move. Now." She said it once, not loud, and stepped past him. She had her gloves on. She was already doing her assessment. Carotid pulse absent, tracheal deviation, absent breath sounds on the left, neck veins starting to distend. She reached for the supply cart and had a large bore needle in her hand before anyone in the room had organized themselves. "Carter," Nicole's voice came from behind her, sharp. "Step back. Wait for the attending." "The attending isn't here and he'll be brain dead in 4 minutes." Emily uncapped the needle. "Someone call Kane. Someone else start compressions. Now." Nicole said, "I am telling you to step compressions," Emily said again, and something in her voice, not volume, not anger, something underneath those things, something flat and absolute, made the second-year tech named Marcus, who had been standing frozen at the crash cart, start compressions without anyone else weighing in. Emily located the second intercostal space, mid-clavicular line, left side by feel rather than by sight, because she was already watching the patient's color. She inserted the needle. The hiss was immediate. Not a small sound. A rush. The pressure venting, the tension releasing, the physics of a trapped situation suddenly corrected. Damon Reyes' color changed, his chest symmetry changed. Marcus had 2 more compression cycles queued, and Emily said, "Check pulse," and Marcus checked and said, "I've got something." And then, 40 seconds after his heart had stopped, Corporal Damon Reyes had a heartbeat again. Ryan Foster was standing 2 feet away, his hand over his mouth. Nicole hadn't moved from the doorway. Emily stripped her gloves, picked up his chart, and started documenting. Dr. Kane arrived at 1:15 a.m. He had been called the moment the arrest began and had come from the physician's lounge, which was 2 floors up and approximately 5 minutes away, which meant there was a portion of those 13 minutes that was not travel time. He assessed the patient. He reviewed the monitor strips. He asked Ryan for a verbal report, and Ryan gave it. And in Ryan's verbal report, Emily noticed the decompression was described passively. A needle decompression was performed, and Kane did not ask who had performed it. He nodded at the presentation. He made 2 additional orders. He spoke briefly to the patient, who was sedated and could not respond. Then he left. Nicole filed an incident report at 1:43 a.m. documenting that Emily Carter had performed a medical procedure outside her scope of practice and had failed to wait for attending physician direction in an emergency situation. Emily received notification of the incident report at 6:12 a.m. when she was finishing her charting at the end of her shift. She read it twice. She noted the timestamp. She noted the language. She saved a copy to the encrypted drive she kept in her locker, the same drive she had been saving things to for 14 months. Then she went home, slept 4 hours, and came back for her next shift. The second day after Damon Reyes's admission, he was moved from critical to serious condition. The third day, he was upgraded to stable. He was awake, responsive, and according to the overnight nursing notes, had asked twice for his cell phone and once for a specific brand of hot sauce that the dietary department did not carry. Emily had him on her patient list both days. She did his morning assessment, checked his chest tube output, and reviewed his overnight vitals with the precision she applied to every patient. Not with special attention, not with the particular tenderness that some nurses performed for difficult cases. Just the same consistent thoroughness she brought to everyone. On day 3, he was awake when she came in. He was young in the particular way that combat-age soldiers could be young, physically capable, alert, but with something behind the eyes that had already processed things most people his age hadn't touched. He watched her do her assessment the way someone watches a person they're trying to categorize. "You the one who came in during the code?" he said. Emily checked his chest tube. "Output's down from yesterday. That's good." The tech, Marcus, he said a nurse called it, the needle thing. "How's your pain level on a scale of 1 to 10? He was quiet for a moment. "You're not going to answer me." "You're breathing," she said. "Answer's implicit." Something shifted in his expression. Not quite a smile, but adjacent to one. He had the look of someone who had encountered a particular type of person before and was recalibrating their expectations. "Where'd you serve?" he said. Emily looked up from her documentation. She met his eyes once, directly, and then returned to the chart. "I'll let your nurse know your pain level needs reassessing." She left before he could ask again. In the hallway, she passed Nicole, who gave her the look she'd been giving her since the incident report. It was the look of someone who considered the matter settled and was simply waiting for the paperwork to catch up to the outcome. Emily went to her next patient. The meeting with hospital administration happened on day 4 at 8 in the morning in a conference room on the 12th floor that had a view of the mountains if you sat on the right side of the table. Emily did not sit on the right side. Hospital Director Margaret Voss ran the meeting. She was 61, efficient, with the kind of managed warmth that came from decades of navigating between institutional liability and human complexity. She had the incident report in front of her and a legal affairs representative to her left and Nicole Parker to her right. Dr. Kane was not present. His position had been submitted in writing. "Emily," Voss's tone was careful, not unkind. "We want to understand what happened that night, in your own words." "I performed a needle thoracostomy to relieve a tension pneumothorax in a patient experiencing cardiac arrest," Emily said. "The patient had no pulse. The attending had not arrived. Waiting was not a viable option. That procedure is outside. Colorado's Good Samaritan provisions apply to emergency intervention when no qualified physician is immediately available," Emily said. "They're also supported by the ANA's emergency scope guidance and Ironwood's own emergency protocol addendum, Section 4, Paragraph 2, which I can quote if that's useful." There was a pause. Voss's expression shifted. Not much, but Emily caught it. It was the look of someone who had come into a meeting expecting a certain kind of conversation and was quietly recalculating. "You're familiar with the protocol addendum," Voss said. "I'm familiar with all of them." Nicole shifted in her seat. She bypassed chain of command. She made a unilateral, "I made a clinical decision in a 900-second window between recognition and death." Emily kept her voice level. The chain of command was not present. The patient was. The legal affairs representative was taking notes at a pace that suggested he'd already identified this as something more complicated than routine. Voss said, "Emily, you understand this still needs to go through a formal review process. Your privileges may be—" "I understand." Emily folded her hands on the table. "I'd also like to submit 14 months of documentation regarding patient safety concerns I've flagged through appropriate channels and the responses I received." Silence. "I have copies with me," Emily said. "If you'd like to begin." She set a folder on the table. It was not thin. Voss looked at it the way people look at something they suspect will take up more of their day than they'd planned. "We'll review all submitted materials as part of the formal process." "Of course." Emily pushed the folder an inch closer. "I'm available whenever." The meeting ended 20 minutes later. Emily rode the elevator back to the ICU, clocked in, and picked up her patient assignments. What she had not told anyone in that room, what she had not told anyone in 14 months at Ironwood Medical Center, what she had not told anyone since she'd left the Army at 26 and moved to Denver under a name she'd been born with but that now felt like a borrowed coat, was that the procedure she had performed on Damon Reyes in that frantic, screaming minute was something she had done before. Not in a simulation, not in training. In a compound outside Kandahar, with a piece of equipment improvised from what was available and a soldier named Torres bleeding out into the dirt while someone 40 meters away was still shooting. She had performed that intervention and 3 others in a 2-hour period that had later been described, in a classified after-action report she would never read, as a series of decisions that preserved multiple lives under conditions that exceeded reasonable expectations of any medical personnel. She had been 24. She had received the treatment she always received, a brief acknowledgement, a return to duty, and the assumption that she would continue to be available. She had continued to be available. She had continued to be available until the ambush that had not been in the briefing, outside a village whose name she couldn't say without her jaw tightening, where she had spent 2 hours keeping 4 men alive, and had been pulled out with a titanium rod in her left femur, a perforated eardrum, and a TBI assessment that the intake physician had flagged and then filed incorrectly. She had separated from the Army 14 months after that. She had come to Denver. She had gotten a job. Nobody had asked what came before the job application, and Emily had not offered it. On the afternoon of day 4, she was in Bay 7 doing a dressing change when Marcus, the tech who had done compressions on Damon Reyes, appeared in the doorway with an expression that was trying to be neutral and not quite making it. "There are people here," he said. "What kind of people?" "Military people," he paused. "A lot of them, like full uniform. They're talking to the charge nurse." Emily kept her eyes on the dressing. "Okay. Em." He almost never used her name. "They're asking for you." She pressed the tape down along the edge of the dressing. She checked the wound. She noted the improvement in her documentation. Then she pulled off her gloves, dropped them in the waste container, washed her hands at the sink in the corner, 20 seconds, proper technique, and turned around. "What bay is Corporal Reyes in?" she said. "He's in 6. But they're not—" "Emily, they're not asking for his room." She looked at Marcus. "They're asking for Carter," he said, "by rank." The word landed in the space between them, and neither of them touched it for a moment. Then Emily Carter, who had spent 14 months being invisible, being assigned the worst beds, being talked over and filed against and handed the mop, walked out of Bay 7, down the corridor of the ICU that she had been quietly protecting for over a year, and turned the corner. At the far end of the hallway, in front of the nurses' station where Nicole Parker stood with her mouth slightly open and Dr. Ryan Foster stood with his granola bar forgotten in his coat pocket, 4 United States Army officers in dress uniform were standing in a row. The one in front had the kind of rank on his shoulders that made the hallway feel smaller. He saw her. And then, in the middle of the ICU of Ironwood Medical Center in Denver, Colorado, in front of the charge nurse who had filed a report against her, in front of the resident who had watched her save a man's life and said nothing, in front of every person who had handed her the mop and pointed at the dirty assignment board, General Richard Halford brought his right hand to his temple in a crisp, precise, and absolutely unambiguous salute. "Staff Sergeant Carter," he said. His voice was not loud. It didn't need to be. "We've been looking for you for 6 years." The monitor in Bay 4 beeped once, twice, and then the ICU went completely, utterly still. Nicole Parker's face had done something it had not done once in the 14 months Emily had worked under her. It had gone completely blank, all the authority and confidence draining out of it like water from a pulled plug. Emily stood at the edge of the nurse's station. She did not move. She did not speak. For 3 seconds that felt considerably longer, she simply looked at General Halford, at the officers behind him, at the ribbons on their chests that told their own stories in a language most people in this hallway would never learn to read. And then her eyes went to Damon Reyes's room, Bay 6, where she could see through the glass that he was sitting up in bed, watching. He had known. He had already known. The Marine who had asked her where she served, who had looked at her with that particular recognition in his eyes, he had known exactly who he was looking at, and he had made a phone call, and that phone call had made another phone call, and now General Richard Halford was standing in her ICU with his hand at his temple waiting for her to answer. Emily Carter looked at the general. The look on his face was not ceremonial. It was not performed for the audience gathering at the edge of the hallway. It was the look of a man who had spent 6 years wondering about a decision she had made in the dark, outside a village she couldn't name, and who had finally found the person he'd been trying to find. Somewhere behind her, she heard Nicole Parker take a sharp breath, and Emily Carter did not return the salute. Not yet. Because she was looking past the general, past the officers, at the door to the conference room down the hall, where, through the narrow window, she could see Margaret Voss standing with the folder Emily had placed on the table that morning. And next to Voss, Dr. Victor Kane, who had seen everything, who was the color of old chalk, and who had just realized that the incident report he'd supported was about to become the least of his problems. Picking up from the exact final line of Part 1, Kane had been in medicine for 23 years. He had navigated malpractice reviews, DEA audits, and a wrongful termination suit that had quietly settled in 2019. He was not, by any reasonable measure, a man who scared easily. But the color that had drained from his face in the last 30 seconds was not coming back. Emily watched him through the conference room window for exactly 2 more seconds, long enough to confirm what she already knew, which was that Kane understood what General Halford's presence meant, even if he didn't yet understand the full shape of the problem. And then she turned back to the hallway. Halford still had his hand at his temple. Emily breathed in through her nose. She brought her right hand up, sharp and clean, thumb alongside her forefinger, and returned the salute. The sound that came from the gathered staff at the edges of the hallway wasn't quite a gasp. It was the sound of a collective recalibration, like a room full of people who had been looking at something one way their entire lives and had just been handed a different set of lenses. Halford dropped his salute first. He stepped forward and extended his hand, and when Emily took it, his grip was the kind that communicated something specific. Not dominance, not ceremony, but the straightforward pressure of one person acknowledging another as an equal. "You're a hard woman to find, Sergeant," he said, quieter now that the formality was done. "I wasn't hiding," she said. "I was here." "We know that now." Something moved behind his expression. Not quite regret, but adjacent to it. "That's the part we're going to have to talk about." Nicole Parker had not moved from behind the nurse's station. She was gripping the edge of the counter with both hands and wearing the expression of a person who has just realized that the floor they've been standing on for years is thinner than they thought. Ryan Foster had moved. He'd come 6 steps closer, almost involuntarily, the way people drift toward things they need to see clearly. Margaret Voss appeared in the hallway from the conference room door. She had the folder under her arm and the legal representative close behind her, and she was doing the rapid administrative calculation that her position required. A calculation Emily had watched happen on her face before, but never quite this quickly or with this much visible effort. General Halford. Voss extended her hand when she reached him. Her voice was composed. Whatever Voss was feeling, she had built the kind of career that meant it would stay below the surface. Margaret Voss, hospital director. We weren't notified of your visit. No, Halford said. He shook her hand. You weren't. A small silence. Is there somewhere we can speak privately? Voss said. We can speak here, Halford said. Not rudely, just with the particular economy of a man who had made larger decisions in louder places and was not moved by the preference. What we have to say isn't private. Some of it, Sergeant Carter's colleagues should hear. Emily said nothing. She stood with her hands loose at her sides and her face arranged in the expression she'd been using for 22 months. Since before Ironwood, before Denver, since the intake office at Fort Riley, where she'd signed her separation papers and taken the Metro card the Army gave you on your way out the door. The expression of someone who was present, who was absorbing information, and who was giving nothing back until she decided to. We received a call, Halford said, and his voice carried without effort. 41 hours ago, from Corporal Reyes. He glanced toward Bay 6, where through the glass Damon Reyes was sitting up with his hands in his lap, watching. He described the nurse who intervened during his cardiac arrest, the procedure, the context, the way it was done. He paused. There are approximately 40 people alive in the Army today because of the way that procedure gets done when there's no time to do it the right way. Corporal Reyes recognized the technique. He knew what it meant. The hallway was very quiet. A monitor beeped somewhere down the row. Nobody moved to check it. Staff Sergeant Carter, Halford continued, served 2 tours. She was assigned to the 75th Ranger Regiment as an attached medical specialist, a role that doesn't show up in most public records because the operations it supported don't show up in most public records. He was not reading from anything. He was saying words he had clearly said before, in different rooms to different audiences. She was recommended for the Distinguished Service Medal following an operation in which she maintained clinical function under direct fire for 112 minutes, treating 4 critically wounded soldiers with field-adapted equipment, and was herself wounded during extraction. Ryan Foster's hand had come up to his mouth again. Nicole Parker had stopped gripping the counter. She had dropped her hands to her sides, and she was standing the way people stand when they've been physically struck, upright, but not quite coordinated. She was medically separated, Halford said, following a traumatic brain injury that was assessed, incorrectly as we later determined, as minor. She was discharged with standard benefits and a file that did not accurately reflect her service record. He stopped. His jaw worked once. That was a failure, on the part of this institution, and it's one of several things I'm here to address. Voss said carefully, What are the others? Halford looked at her, then at Emily. Sergeant Carter, would you prefer I continued, or would you like to— You can continue, Emily said. The Distinguished Service Medal was approved 6 weeks after her separation. The paperwork reached her last known address and was returned unclaimed. We've been attempting to locate her through standard channels since. He said it without editorializing. We have found her through a 22-year-old corporal who recognized a needle decompression performed under pressure and called it in. Damon Reyes had known within the first hour of being conscious. He'd seen the technique, the angle, the economy of motion, the complete absence of hesitation, and known it wasn't something you learned in a civilian nursing program. He'd had it done to him once before, in a training exercise gone sideways at Fort Garland by a medic who'd learned it from someone else, and that someone else had learned it from someone whose name kept coming up when people talked about a certain operation in a certain province, whose name never appeared in press releases. He had been 50% sure. He'd gotten her name from his chart, called his CO, and his CO had called someone, and within 18 hours the chain of reaction had reached Halford's desk. The remaining 30% of his uncertainty had disappeared when she'd walked out of Bay 7 and he'd seen her face. Dr. Kane came out of the conference room. He had clearly made a decision in there about how to play this, and the decision he had made was confrontation. A choice Emily had seen coming, and that she thought said something specific about Kane's read of the situation, which was that he still believed the situation was about nursing scope of practice, and that he could manage it. This is highly irregular, he said, and his voice was the one he used for residents he was displeased with, measured, authoritative, certain of its own weight. General, I respect your service, but this is a hospital, and what happened in this ICU 4 nights ago was a clear violation of clinical protocol that has already been reported through proper. Dr. Kane, Halford's voice hadn't changed in volume, but something had changed in it, the way the temperature in a room changes before rain. I'm aware of the incident report. Kane paused. Then you understand? I understand, Halford said, that you arrived 13 minutes after cardiac arrest was called. I understand that the resident on duty did not initiate intervention, and I understand that the nurse who intervened, correctly, effectively, and with the specific clinical knowledge that you would have no reason to expect from a standard nursing hire, was subsequently reported rather than supported. Kane's jaw tightened. She performed a physician-level procedure She performed a life-saving intervention in your absence and stabilized a United States service member. Halford said it the way people say things that are simply facts and have ceased to require argument. I'd choose my next words carefully, Doctor. She violated Victor. Voss's voice cut across him, sharp and quiet, the first time Emily had ever heard the director use his first name. Stop. Kane looked at Voss. Voss was looking at the folder under her arm, the one Emily had placed on the table that morning with both hands and a very specific kind of patience. She looked at it the way you look at something you've already opened and read enough of to understand what the rest of it contains. We'll discuss the incident report internally, Voss said, at length, but not here. Kane's face did something complicated. He had enough political instinct to recognize when a room had shifted, but not enough flexibility to respond to it with anything other than resistance. He looked at Emily the way he had looked at her for 14 months, like a problem that had not yet been solved to his satisfaction, and then he looked away. Emily watched him do it. She noted the way he recalculated without conceding. She had seen that look before, in a different context, on a different continent, on the face of a logistics officer who had argued about equipment allocation while 4 men bled in a courtyard. That officer had been wrong too. The officers who had come with Halford were a colonel named Adkins, a major named Strickland, and a young captain whose name Emily didn't catch because she was managing several things at once, and the captain hadn't spoken yet. Adkins was Logistics and Records. Strickland was JAG. The captain was, she would later determine, a public affairs officer who had been brought along for reasons that would become clear in about 4 hours. Halford asked for a private room to speak with Emily, and Voss offered the family consultation suite on the far end of the ICU. A room with upholstered chairs and a box of tissues on the table, the kind of room where people were told things they didn't want to hear. It occurred to Emily, as she followed Halford into it, that she had sat in this room twice in the past year telling families things they didn't want to hear. She had never been the one sitting in the upholstered chairs. She sat in one now. Halford sat across from her. Adkins stood by the door. Strickland had a legal pad. I want to be straightforward with you, Halford said. We owe you that at a minimum. All right, Emily said. Your separation was mishandled. The TBI assessment was incomplete, the follow-up care coordination failed, and the decoration, which was approved by SOCOM and signed by the Army Chief of Staff, was never delivered. He set his hands on his knees. He was in his early 60s, with the kind of face that had been weathered by enough things that it had stopped changing very much. That is a failure by the Army of the United States, and it's one I intend to formally document and correct. Emily was quiet for a moment. Correcting it now doesn't... No, he agreed. It doesn't, but it also doesn't mean we don't do it. She looked at the table. There was a crease in the wood where 2 pieces of veneer had separated slightly at the join. She looked at it the way she looked at things when she needed a second to process something without giving the processing away. What do you want? She said. It was direct enough that Adkins shifted by the door. Halford didn't shift. That's what I want to ask you. We have options to put forward. But you've spent 6 years making your own arrangements, Sergeant, and I don't want to come in here with a plan and act like the last 6 years didn't happen the way they did because we weren't paying attention the way we should have been. Emily looked up at him. Options. There's a reinstatement pathway. Limited with your separation conditions, but possible with the TBI reassessment corrected on the record. There's a civilian advisory role, medical, a SOCOM training program. The decoration ceremony, which will happen regardless of what you decide. He paused. And there's the matter of what happens here, at this hospital, which is, I gather, more complicated than we understood when we arrived. What did Reyes tell you? That you were the best nurse in the building and that the building didn't know what it had. He said it without embellishment. He also said you'd been assigned every difficult case for a year and that you'd flagged concerns that weren't being heard. Emily thought about the folder on the conference table. 14 months of documentation. Medication errors caught and corrected without credit. Incidents reported and filed and forgotten. A pattern she had assembled not because she'd intended to use it, but because she was the kind of person who kept records, had always been the kind of person who kept records. Because records were what you had when the version of events that got told didn't match the version that actually happened. The documentation I submitted this morning, she said. How much of it did Voss read before she came into the hallway? I don't know, Halford said. Enough, Strickland said from his position with the legal pad. Based on her expression when she came out. Emily nodded slowly. There's more that isn't in that folder. I didn't bring everything. A pause. What's the more? Halford said. A nurse named Patricia Solano flagged a dispensing error in the pharmacy protocol 8 months ago. The error was in the override system. High alert medications being cleared without second verification. She documented it, submitted it to Kane, and was reassigned to overnight float pool within 2 weeks. Emily kept her voice even. She filed a complaint with the state board. It was reviewed and closed without action. I have her documentation because she gave it to me before she transferred to Presbyterian 6 months ago. She looked at Halford. I also have 3 other incidents involving Kane's residence where the documentation in the official record doesn't match the documentation from the nurses who were in the room. Strickland had stopped writing and was looking at her. You've been building a file, he said. I've been documenting patient safety concerns through appropriate channels, Emily said. The channels didn't work, so I kept documenting. Halford was quiet for a moment. Then, Major Strickland. Sir? We're going to need to expand the scope of this visit. Strickland already had his phone out. They spent 40 minutes in the consultation suite. By the time Emily walked back out into the ICU, it was mid-afternoon and the light through the west-facing windows had turned the hallway the particular shade of gold that made everything look temporarily more significant than it was. Marcus was at the nurse's station. He had been doing charting with the focused intensity of someone who was doing charting specifically because it gave him a reason to be near the nurse's station without looking like he was waiting. He looked up when Emily came out. You okay? He said. Yes. Okay? He nodded. Reyes has been asking for you. I know. She had seen the light on outside Bay 6 from the consultation room window. I'll go in a minute. She went to the med room first. Did her 12 o'clock documentation, checked 2 outstanding labs for a patient in Bay 2. The work was the same work it had been at 6 a.m., the same it had been for 14 months. Specific, unglamorous, requiring attention. She did it the same way she always did it. Ryan Foster found her in the med room. He closed the door behind him, which was unusual. Ryan was not someone who sought out closed-door conversations. He ran on the ambient social energy of open spaces, the slight diffusion of accountability that came from hallways and group settings. I need to say something, he said. Emily looked up from the lab result on her tablet. The night Reyes coded. The report. He was speaking faster than normal, the way people do when they've rehearsed something and are afraid that if they slow down, they'll lose the nerve for it. Nicole filed it, and Kane supported it, and I didn't correct it. The way it was written, it made it sound like you acted recklessly. And you didn't. You acted correctly, and I stood there and didn't act at all, and then I let the report stand. The med room was small. There was a hum from the refrigeration unit on the far wall. Ryan, Emily said. I know this is late, but whatever's happening out there, I want it on the record that the report is filed is not accurate. You saved him. I should have said that immediately, and I didn't. She looked at him. He was doing the thing he always did when he was uncomfortable, which was maintain eye contact with slightly too much effort, as if the effort itself was the apology. Are you willing to put that in writing? she said. Yes. Major Strickland is the JAG officer with General Halford. He has a legal pad and he's in the family consult suite. She turned back to the lab result. You should go talk to him. Ryan stood for a moment. That's it? That's it. You don't want to. Ryan. She pulled the result she needed. Go talk to Strickland. He went. She went to Bay 6 at 3:47 p.m. Damon Reyes was sitting with his bed at 45 degrees, a pillow wedged behind his left arm where the IV ran in. He had gotten his phone back. He set it face down on the blanket when she came in. You knew, she said. She wasn't angry. It was simply the most efficient place to start. About 6 hours after they took me off the vent, he said, I wasn't 100% sure until I saw you walk out of that room. What made you call? He looked at the wall across from him for a second. Because someone should have called a long time ago, he said. And because you're in here moving bedpans and the people who should be running this place are running it wrong, and that... He stopped. I don't know. It bothered me. She checked his IV site, checked his drainage. The numbers were good. You didn't have to do that, she said. I know. It's going to complicate things. For me? Here. Probably. He watched her work. But you knew that before I made the call. You had that folder. You'd been keeping records. That's different. Is it? She didn't answer. My CO knew your name, Reyes said. Not specifically, but the description. The medic from the 75th, the Kandahar operation, what happened with Torres and the others. It's a story that gets told. In a certain way. In certain circles. He looked at her directly. You're kind of a known quantity to people who were there. Emily was quiet for a moment. Torres made it, she said. He's at Fort Bragg. I know. He told me about you. A pause. Small world. Smaller than it should be. She made a note on his chart. Your drainage output is where I want it. I'm going to talk to the attending about pulling the chest tube tomorrow if overnight looks good. Emily? She looked up. It was the first time he'd used her name. Thank you, he said, for not letting me die in a Denver hospital because a doctor was 13 minutes away. She looked at him, the 22-year-old with the eyes that had already processed things, and she said, Don't thank me. Stay out of vehicles on I-25. He almost smiled. Copy that. By 5 p.m., the thing had moved faster than Emily had expected, though she had known it would move fast once it moved at all. That was the nature of certain kinds of exposure. They built slowly for years, and then they didn't build at all. They broke. Strickland had spoken with Ryan Foster. He had also, through mechanisms Emily wasn't entirely clear on, gotten copies of the hospital's incident reporting database for the past 18 months, something that would normally require a court order, but that the combination of a JAG officer, a general's authority, and Margaret Voss's increasingly evident willingness to cooperate had apparently expedited. Kane knew this. She could tell from the way he moved through the ICU at 5:15, faster than usual, with the tightly controlled gait of someone who was containing something. He made 2 phone calls at the nurse's station with his back turned to the room, which was something he never did because Kane was generally the kind of physician who made phone calls at full volume and trusted that the status the calls implied would outweigh any concern about content. Both calls were short. Nicole was off shift at 5. She did not leave at 5. She was in the break room at 5:40, and Emily knew this because Marcus told her, and Marcus knew because Marcus was the kind of person who tracked things instinctively in the same way that certain animals track weather. She's been on her phone in there for 40 minutes, he said. Okay, Emily said. What do you think she's doing? Calling a lawyer, Emily said. Or trying to. At 6 p.m., Voss called Emily to her office. The office was on 12, the same floor as the conference room with the mountain view, but the office itself faced east and the evening light wasn't doing it any favors. Voss was behind her desk. The folder Emily had submitted was open in front of her. There was a second folder Emily didn't recognize. Sit down, please, Voss said. Emily sat. I've spent the last 4 hours on the phone, Voss said, with our legal counsel, with the state health department, with the Joint Commission, she paused, and with General Halford. All right. The documentation you submitted contains several items that, if accurate, constitute reportable events under Colorado's patient safety statutes. She spoke carefully, the way someone speaks when they've been told to speak carefully by a lawyer. We're obligated to initiate a formal internal review and notify the relevant oversight bodies. I know, Emily said. That's why I documented them. Some of these events, Voss said, occurred on shifts where the supervising physician was Dr. Kane. She was looking at the folder, not at Emily. And the falsification concern, if the chart alterations you've flagged are verified, they're documented in real time, Emily said. Photographs of the original entries, photographs of the amended entries, timestamps on both. It's in the supplemental section, tabs 7 through 11. Voss finally looked up. You photographed the chart amendments, she said. I photographed every significant discrepancy I witnessed, starting from month 2. Emily met her eyes. I knew what I was looking at. I'd worked in environments where documentation was the only thing that stood between what happened and what got reported. A long silence. Emily, Voss said, and this was different. Not the managed tone from the conference room, something more human underneath it. Why didn't you come to me with this earlier? Emily thought about how to answer that honestly without it becoming something it didn't need to become. Because the first time I flagged a concern to Dr. Kane, she said, I was given the hardest assignment rotation on the floor for 3 weeks, and because Patricia Solano went to you, went through proper channels, and ended up in float pool. She paused. I needed more. Before I came to you, I needed enough that it couldn't be managed. Voss looked like she wanted to say something and then didn't. You have enough now, Emily said. Inspired. The next 2 hours moved in the way that institutional crises move when the institution is still trying to function around them, loudly in some rooms, very quietly in others, and with the particular dissonance of people going through routines while the routines are disintegrating. Kane's hospital privileges were placed under interim administrative review at 7:40 p.m. Emily didn't find out the way she might have expected, through an announcement or a change in the duty roster or a direct communication. She found out because Marcus came to find her in Bay 3 and said, Kane just left. Left. Like car in the lot left, with the expression of someone reporting something they hadn't expected to be reporting. She nodded. What does that mean? Marcus said. It means go check the Bay 2 potassium, she said. It was borderline an hour ago. Marcus went to check the potassium. At 8:30, Halford came back to the ICU. He'd been in another part of the hospital for most of the afternoon. She'd gotten brief updates through Strickland, but hadn't seen him since the consultation suite. He looked like a man who had made several phone calls he'd needed to make and had not enjoyed any of them. He found her in the corridor between bays 4 and 5. The DSM ceremony, he said. We'd like to schedule it within the next 2 weeks. Full formal presentation. SOCOM's already been notified. Okay. There's a conversation we still need to have about what comes next, for you. I know, she said. You don't have to decide anything tonight. I know that too. He looked at her for a moment, not the formal look he'd had in the hallway at 1 p.m., but something more considered. You've been sitting on 14 months of documentation, working the worst assignments in the building, and not breaking. I had patience, she said. You break, they notice. Most people would have either left or reported much earlier. Most people would have, she agreed, but I needed it to stick. If I'd brought this in month 3, it would have been one nurse's concerns about her supervisor. Month 14, it's a pattern with documentation. She glanced toward Bay 6, where the light was still on. And I needed someone to find me, someone Reyes would call. Halford was quiet. You were waiting, he said. I was working, she said. The waiting was incidental. She moved to check on the patient in Bay 4, and Halford stood in the corridor for a moment before following his officers toward the elevator. The ICU around them was doing what ICUs do in the evening, settling into its night rhythms, the shift change coming, the fluorescent overhead hum, a constant underneath everything. At Bay 4, Emily found Mrs. Adela Faro, 67, post-cardiac surgery, whose potassium had come back exactly where it needed to be, and whose evening vitals were solid, and who had a daughter who had called 3 times today, and who Emily had spoken to personally because the woman was frightened, and frightened families needed specific information, not reassurance. She updated the chart. She made the evening note. She flagged 2 items for the incoming night nurse and wrote them out in full, not abbreviated because incoming nurses at shift change were inheriting situations and they needed complete information. She was finishing the second flag when Nicole Parker appeared in the doorway of Bay 4. Nicole had not left the building. She had been in the break room, and then she had been in an office Emily didn't know about. And now she was here. And the expression on her face was one Emily hadn't seen from her before. It wasn't the managed authority. It wasn't the patient condescension. It was something rawer and less organized. "I want to talk to you," Nicole said. Emily saved the chart note. "Okay." "Privately?" "This is about as private as it gets during a shift." Nicole looked at the patient, Mrs. Farrow, who had fallen into a light doze, and then lowered her voice. "What you did with that documentation, going outside this hospital, this is a betrayal of—" "I reported patient safety concerns," Emily said. "I went through every channel available to me first. That's documented too." Emily looked at her directly. "Nicole, Solano came to you. She told you about the override protocol. In March of last year. I have the email she sent you and I have your reply." Nicole went very still. "Your reply said you'd look into it," Emily said. "You didn't look into it. 4 months later, there was an adverse event involving that same protocol. It's in the state database. It was attributed to system error." She kept her voice even. "It wasn't system error." "You don't know. Oh, I know what the database says, and I know what Solano's documentation says, and I know what your email said, and Major Strickland has copies of all 3. Emily picked up her tablet. "I need to do a shift handoff." "Emily, Nicole." She stopped at the doorway. She turned around one final time. "I didn't do this to you. I documented what I witnessed. The difference matters." She walked out. She did her shift handoff at 9 p.m. to the night nurse, a steady woman named Bridget, who had been at Ironwood for 9 years, and who processed the flagged items with the thorough efficiency of someone who knew how important the details were and didn't need to be told. She changed out of her scrubs in the locker room. She retrieved her encrypted drive. She was pulling on her coat when her phone buzzed. The number was a military exchange. She didn't recognize it, but the format was familiar in the way that certain formats stay with you. She answered it. The voice on the other end said, "Staff Sergeant Carter, this is Colonel Adkins. I apologize for the late hour. We've had a development in the last 20 minutes that General Halford thought you should be informed about before it becomes public." Emily stood in the locker room with her coat half on. "What development?" she said. "Dr. Kane's attorney contacted our office 40 minutes ago." Adkins paused. "He's claiming that the medical records you documented, the discrepancies in tabs 7 through 11, were alterations made by someone on the nursing staff. He's indicating his client intends to file a complaint naming you specifically as the individual who altered the records to support a premeditated campaign against his client." The locker room was very quiet. "He's going to argue," Adkins continued carefully, "that your documentation is fabricated." Emily stood very still. She thought about the timestamps, the metadata on the photographs, the specific order in which she documented things, which she had been careful about, very careful about, specifically because she'd known that the day she used any of it, the first response would be exactly this. She thought about the one thing she hadn't told anyone yet. Not Halford, not Strickland, not Voss. The one piece of documentation she had kept separate from the folder that she hadn't submitted, that was not on the encrypted drive in her coat pocket. "Colonel," she said, "tell General Halford I need 20 minutes tomorrow morning." "Of course, is there—" "And tell him to bring Strickland." She finished pulling on her coat. "There's a secondary drive." A pause on the line. "A secondary drive," Adkins repeated. "Kane amended 2 charts in my presence," she said. "He didn't know I had a second recording device. The drive has 27 minutes of video." The silence on the other end of the line was the particular silence of someone doing math very quickly. "Staff Sergeant," Adkins said slowly. "What kind of recording device?" "The kind that fits in a badge clip," she said. "I've been wearing it for 8 months." Adkins was quiet long enough that Emily could hear him breathing. 27 minutes, he said finally. Continuous. 2 separate incidents. He's on camera making the amendments. You can see the original entries before he touches the chart, and you can see what the entries look like after. She zipped her jacket. The badge clip has a timestamp overlay. It syncs to the hospital's internal clock system because I calibrated it that way. You calibrated? Adkins stopped himself. I'll tell the general. Tell him 7 a.m. I'll bring the drive. She ended the call and stood in the empty locker room for a moment. The ventilation system pushed recycled air through the overhead grate. Her left femur ached the way it always ached at the end of a long shift, the titanium rod conducting cold from the inside out. A detail she had never mentioned to anyone at Ironwood because it was irrelevant to her ability to do her job, and because the moment you mentioned a physical limitation in a place like this, it became the thing people reached for when they needed a reason. She left the building through the side exit and walked to her car in the structure on level 3. Denver at 9 p.m. in early March was cold and clear, the kind of cold that didn't negotiate. She sat in the driver's seat for 90 seconds before starting the engine, not because she was overwhelmed, but because she was doing the same calculation she always did at the end of a day, where the variables had shifted, what had changed, what that meant, what the next 12 hours required. Kane's attorney had moved fast. Faster than she'd expected, which meant Kane had anticipated exposure before tonight, possibly before Halford had arrived, possibly the moment Emily had placed the folder on the conference table and he'd seen the thickness of it through the glass. He'd been preparing. The counter-allegation wasn't improvised. It was a strategy someone had thought through, and the speed of it told her Kane had a lawyer he'd used before, someone practiced at this specific kind of defensive maneuver, claiming the nurse fabricated the records. It was straightforward. It was the kind of allegation that required only enough ambiguity to muddy the water, to shift the inquiry from Kane's conduct to Emily's credibility, to make the whole thing complicated enough that institutions preferred to quietly resolve rather than publicly pursue. It would have worked, probably, on a different nurse, on someone without a badge clip and 27 minutes of continuous video and 8 months of patience. She started the engine and drove home. She was back at 6:40 a.m. Strickland was already in the family consultation suite with a laptop and 2 cups of coffee he'd gotten from somewhere, and when Emily came in and set the secondary drive on the table, he looked at it the way lawyers look at things they want very much, but are professionally required to assess before wanting. "Walk me through the chain of custody," he said. She did. The badge clip, the calibration process, how she'd stored the files, encrypted, dated, with a verification hash she'd run through a civilian forensics tool she'd paid for out of pocket specifically because she needed something defensible. She had, she told him, documentation of the tool itself and the verification outputs for each file. Strickland was typing. Halford arrived at 7:12, which was 12 minutes late, and which, from a man like Halford, communicated something about the phone calls he'd been making since 6 a.m. Kane's attorney filed a formal complaint with the state nursing board this morning at 6:53, he said, without preamble, pulling out a chair, alleging record falsification, conduct unbecoming, and deliberate interference with physician authority. Emily had expected this. She said, "Okay." It triggers an automatic review. Your nursing license is under provisional status until the board completes its inquiry. He sat. That could take 60 to 90 days. The room was quiet except for Strickland's typing. "He's trying to sideline me," Emily said, "while the hospital investigation is active. If my license is in question, anything I testify to becomes contestable." "Yes," Halford said. "He's done this before," she said. It wasn't a question. Halford looked at her. "Strickland." Strickland pulled up something on his laptop and turned it around. A case number. A state board record from 6 years ago, Colorado. A complaint filed against a travel nurse who had flagged improper prescribing at a facility where Kane had previously held privileges. The complaint had named the nurse as the source of the irregularities. The case had been reviewed and closed. The nurse had left nursing within a year. Emily looked at the screen. She absorbed it. She turned it back to Strickland. "I need the board to see the video before they formalize the provisional status," she said. The board doesn't typically accept evidentiary submissions during the initial intake phase, Strickland said. There's a process. I know there's a process. She kept her voice level. Is there a mechanism to expedite the evidentiary review when the complaint is demonstrably retaliatory? Strickland looked at Halford. Halford said, There's a federal patient safety whistleblower protection provision. If we frame the complaint correctly, and we can, given what's in those files, it triggers a mandatory parallel review by HHS. The state board has to coordinate. He paused. It's aggressive. Kane's attorney filed at 6:53 a.m., Emily said. He's not playing slow. A beat. No, Halford agreed. He's not. She pushed the secondary drive another inch towards Strickland. Then let's not play slow either. What happened in the next 4 hours was the kind of institutional movement that looks, from the outside, like a wave, but is actually dozens of individual decisions made under pressure by people who are suddenly very aware of where they are standing and what the ground beneath them is doing. The federal whistleblower filing went in at 8:40 a.m. Strickland submitted it personally with attachments and copied the State Board, the Joint Commission, and the Colorado Department of Public Health. The video files were authenticated by a civilian forensic specialist Strickland had on retainer, a woman who arrived at Ironwood at 9:15 with equipment Emily didn't recognize, and who completed her verification in 40 minutes and submitted her report electronically before leaving without speaking to anyone except Strickland. By 10 a.m., the State Board's automatic provisional status on Emily's license had been flagged for expedited review pending the federal coordination trigger. By 10:40, the Joint Commission had opened an unannounced inquiry into Ironwood Medical Center's incident reporting practices, which meant a site visitor was en route from Chicago. Kane's attorney called Strickland at 11 o'clock. Emily wasn't in the room for that call, but Strickland found her in the ICU 20 minutes later and said, He's requesting a meeting. His client wants to discuss terms. Emily was at Bay 2 checking a post-op drainage line. She finished the check before she responded. Terms, she said. Quiet resolution, his language. Strickland kept his voice below the ambient noise of the unit. He's offering to withdraw the nursing board complaint in exchange for... No, she said. Strickland hadn't finished the sentence. You don't want to hear the exchange? No? She noted the drainage output. The complaint goes on record. The review proceeds. If Kane's attorney wants to withdraw it, he can withdraw it without conditions. She looked at Strickland. The moment I agree to terms, everything that comes after looks negotiated. I'm not giving him that. Strickland nodded slowly. He had the expression of someone who respected an answer they'd half expected. He was turning to leave when his phone buzzed. He looked at the screen. Something shifted in his face. Not alarm exactly, but a rapid recalculation. The kind that happened when a situation changed in a direction that hadn't been modeled. What? Emily said. He looked up. Nicole Parker just walked into the Joint Commission site visitors' preliminary meeting. He paused. She asked to give a statement. Emily went still. She's not on the visitors' schedule, Strickland continued. She showed up and asked. They let her in. He was reading from his phone. She's been in there for 11 minutes. The question was what Nicole was saying. The shape of it could go two ways. She could be defending the institution, defending Kane, trying to manage the narrative the way she'd been managing it for years. Or she could be doing something Emily hadn't anticipated. She thought about the break room the night before, the 40 minutes on the phone, the expression on Nicole's face in Bay 4. Not the controlled authority, but something underneath it that Emily had cataloged and not yet fully categorized. She thought about the email Nicole had sent Solano, the reply that had said she'd look into it, and the 4 months of nothing that had followed. She thought about someone who had spent 2 decades in a building learning which walls to lean on, and what happened when the walls started to move. How long is the preliminary meeting? She said. Usually 30 minutes, Strickland said. They're at 13. Emily looked at the door to the consultation corridor, then at Bay 6, where Damon Reyes's light was on, and his blinds were half open, and she could see the shape of him sitting upright, alert, watching the activity in the unit with the particular attention of someone trained to track developing situations. 17 minutes. Whatever Nicole was saying in that room, in 17 minutes it would be part of the record. Emily's phone buzzed. Unknown number. Denver area code. She answered it. Is this Emily Carter? A woman's voice. Careful. Not a lawyer's careful. Something else. Yes. My name is Patricia Solano. A pause. I heard what's happening at Ironwood. I saw the Joint Commission notification. Another pause. Shorter. I kept my own records. From before I left. I have the original dispensing logs. The ones from before the system was updated. The ones that show the override approvals. Emily stood in the middle of the ICU with the phone against her ear. The system update happened in September, Solano said, 3 weeks after I filed my complaint. After the update, the original approval records weren't visible in the standard interface anymore. But they weren't deleted. They were archived. I pulled them before I transferred. Her voice was steadier now. I have 74 records. 41 of them have Kane's override signature. The weight of it landed in Emily's chest the way significant things landed. Not dramatically, but with a density that required a second to fully register. 41 overrides, high alert medications, signatures. Patricia, Emily said, are you willing to submit those records to a federal inquiry? Silence on the line. Not hesitation. Emily could tell the difference. This was someone who had already made the decision and was simply acknowledging the moment of it. That's why I called, Solano said. Emily looked across the ICU. Through the glass of Bay 6, Damon Reyes had shifted and was watching her now. Directly, with the kind of focus that meant he could tell from 30 feet away through a window that something had just changed. Hold on, Emily said into the phone. She looked at Strickland. Call Halford, she said, right now, and get me a conference line. Strickland was already dialing. Emily pressed the phone back to her ear and said, Patricia, don't submit anything yet. We're going to do this together, and we're going to do it in a way that it cannot be undone. At that exact moment, from down the corridor, the door to the Joint Commission preliminary meeting opened. Nicole Parker walked out. Her face was not the face of someone who had been defending the institution. Her eyes found Emily's across the length of the hallway, and in them was something Emily hadn't expected. Not hostility, not triumph, but the exhausted, stripped-down look of someone who had finally put down something very heavy. Behind Nicole, the site visitor appeared in the doorway with a notepad and an expression that said the last 13 minutes had been considerably more informative than preliminary meetings usually were. Emily stood at the center of it, the phone with Solano, Strickland's call connecting to Halford, Nicole across the hall, the site visitor with the notepad, and somewhere in the building Kane's attorney waiting for a response to a settlement offer that was never coming. Then Strickland's phone connected, and she heard Halford's voice say, What is it? And Strickland said, Sir, we have a second witness, with 74 archived records. And in the conference room, 2 floors above them, Margaret Voss picked up her own phone and saw a number she had not expected to see on her screen, the direct line of the Colorado Attorney General's office, and understood, in the particular way that institutional leaders understand such things, that the morning had just become something that would not be resolved quietly or quickly or in any way that resembled what she had walked into work expecting to manage. Voss picked up the call on the second ring. She listened for 11 seconds. Emily could tell it was 11 because she was watching the clock on the wall above the nurse's station while she managed 3 other things simultaneously. Solano on one line, Strickland relaying updates from Halford, and the site visitor from the Joint Commission who had come out of the preliminary meeting with Nicole and was now standing in the hallway with the particular stillness of someone who needs a room and a working outlet immediately. What the Attorney General's office told Voss in those 11 seconds, Emily would not learn verbatim until later. But she could read the architecture of it from across the building, could read it in the way Voss appeared at the end of the 12th floor corridor 6 minutes later, walking toward the elevator with her phone still in her hand and the folder under her arm and the expression of someone who had just understood that the institution she'd spent 11 years running was now the subject of something that would not be resolved by an internal process. The AG's office had not called speculatively. They had called because the Joint Commission notification had crossed their desk at the same time as an anonymous tip. Emily would later learn it came from Patricia Solano, filed 3 days earlier as a precaution, before she'd called Emily directly. and the combination had triggered their patient safety division's automatic review protocol. They were not requesting cooperation. They were notifying Ironwood that an investigation was open. Voss stepped into the elevator. The doors closed. Emily told Solano, "I'll call you back in 30 minutes with a secure number," and ended the call, and looked at Strickland and said, "What do we need before noon?" "Halford wants a full briefing with everything assembled. Video files, Solano's records, your documentation, Ryan Foster's written statement, and Nicole Parker's joint commission statement. Whatever she gave them, we need a copy." Strickland was already moving. "He's also reached out to the Army's Inspector General. Given your service record and the circumstances of your separation, there's a parallel track opening on the military side." "That's separate," Emily said. "It runs parallel. It doesn't interfere with what's happening here." She nodded. She looked at the site visitor, who had found a wall outlet near the waiting area and had her laptop open. "She needs access to the incident reporting database. Who's the IT liaison for external audits?" "I have no idea," Strickland said. "I do." Emily went to the nurses' station, found the directory on the terminal, and came back with a name and extension written on the back of a supply request form. She handed it to the site visitor, who took it without ceremony and dialed immediately. This was how it went. Not smoothly, not in the way procedural narratives described institutional investigations, with clean handoffs and orderly revelations. It went the way complex things actually went when they finally broke open, which was with multiple timelines running at different speeds, and nobody having complete information at any given moment, and everyone working from partial maps. Emily knew this. She'd operated in worse coordination conditions. She moved through it the way she moved through everything, one decision at a time, in order of priority, without attaching too much to any single outcome before it cleared. Nicole's statement to the Joint Commission took Emily 20 minutes to obtain a summary of, because the site visitor was not obligated to share it, and the site visitor's supervisor had to be reached, and a protocol had to be cited, and it was Strickland who cited it correctly while Emily watched and said nothing. When she read the summary, she understood the expression on Nicole's face in the hallway. Nicole had not defended the institution. She had not defended Kane. She had given a factual account of Patricia Solano's original complaint, the meeting Nicole had held with Solano in March of the previous year, and what had happened after, which was that Nicole had brought the dispensing protocol concern to Dr. Kane directly, had been told it was a systems issue already being addressed by pharmacy, and had documented the conversation and filed it. The filing had gone into a subdirectory of the incident management system that Nicole had not had access to review afterward. She had also told the site visitor that she had subsequently learned the issue was not resolved. She had learned it, she said, from Emily's folder, the one Emily had submitted to administration the morning of Halford's arrival. Emily sat with this for a moment. Nicole had read the folder, not just Voss. Nicole had gotten access to it, or to a copy of it, and she'd read enough to understand that the chain she'd trusted had broken somewhere between her filing and the subdirectory where it had been buried. Kane had buried it, not Nicole. This was more complicated than Emily had allowed for in her model of the situation, and she was honest enough with herself to acknowledge it. She had assumed Nicole was complicit. The record now suggested Nicole had been managed, kept close enough to be useful, kept uninformed enough to be deniable. It didn't undo 14 months of difficult assignments and incident reports filed against her. Those decisions were Nicole's own, but it changed the shape of what had been deliberate and what had been constructed. She filed the revision and moved on. Kane's attorney called Strickland again at 12:35. Emily was in the break room eating half a sandwich she'd brought from home when Strickland appeared in the doorway. He had the phone in his hand, not to his ear, and his expression was one she was beginning to read accurately. It was the expression he wore when something had happened that reorganized the existing parameters. "Kane wants to speak to you directly," he said. Emily looked at the sandwich. "No." "His attorney is requesting—" "I know what his attorney is requesting." She took another bite. "The answer is no. Any communication goes through you and Halford. He's claiming there's context you're not aware of. His attorney says it changes the nature of the pharmacy records." "What context?" "He won't say until there's a direct conversation." Emily put the sandwich down. "That's not context, that's leverage. He wants a channel that isn't being recorded." She picked it back up. No direct conversation. If he has material information, he submits it through proper channels. Strickland nodded. He was already composing the reply in his head, she could tell. One more thing, he said. The AG's office called Voss again. They want access to personnel files, specifically Kane's credentialing history and his privilege applications going back 10 years. Emily thought about what 10 years of Kane's credentialing history might contain. She thought about the travel nurse case Strickland had shown her that morning, the complaint filed 6 years ago, closed without action. She thought about how credentialing committees worked, what they looked at, and what a person with Kane's particular skill set could suppress if he understood the process well enough. He's been at Ironwood for 8 years, she said. Yes. What was before that? 2 facilities, one in Phoenix, one in Albuquerque. Strickland paused. We don't have the files yet. Get them, she said. The afternoon moved with the momentum of something that had been building pressure for a long time and was now releasing it in stages. Emily didn't experience it as triumphant. She experienced it as work. A different quality of work than the ICU, but work with the same requirement for sustained attention over a long period in conditions that were not comfortable. At 2 p.m., Ryan Foster submitted his written correction to the incident report in a formal addendum to the hospital's risk management office, copied to Strickland and the Joint Commission site visitor. It was 4 paragraphs. The language was careful and unambiguous. He stated that the incident report as originally filed did not accurately reflect the sequence of events, that Emily Carter had performed a clinically indicated intervention under conditions that constituted emergency justification, and that he had been present and had not intervened before she did. Emily didn't read it until 3 hours later. When she did, she read it twice and noted that Ryan had not softened the part about his own inaction. He hadn't buried it in qualifying language or distributed responsibility. He'd said he froze in those words, and that Emily had moved when he didn't. That cost him something. She knew what it cost, professionally and personally, to put that in writing when you were 2 years into a residency and your attending's opinion of you still shaped your trajectory. She noted it the way she noted important things, without commentary, but without forgetting. At 3:30, the forensic specialist's authentication report on the badge clip footage was filed officially with the federal inquiry. 27 minutes of continuous video, timestamp verified, metadata intact. 2 separate incidents in which Kane could be seen accessing patient charts and making amendments, on camera, following the original entry, and before the standard charting window had closed. Amendments that bore no corresponding addendum, no co-signature, no notation that they were corrections. In the first incident, a medication dosage. In the second, a timing entry that changed the documented sequence of a patient deterioration event, a change that, if accurate, would have altered the apparent response time of the attending physician. It would have made a 31-minute gap look like 12. This was the one that had made Strickland stop writing. A 31-minute gap in an acute deterioration event was the difference between a reviewable delay and a response within standard parameters. Kane had changed it. Emily had been in the room. She'd watched him do it with the specific, quiet attention she'd developed over 8 months of wearing a badge clip, and she'd understood immediately what she was seeing. Not a correction, not a clarification, but a cover. The patient had recovered. But if they hadn't, the altered record would have protected Kane from a timeline that placed him outside standard of care. Emily had documented it and said nothing. She had said nothing because the patient was alive and because the moment she disclosed the recording, she had one use of it. She'd needed it to count. It was counting now. Kane's credentialing files from Phoenix came through at 4:47, forwarded by Strickland from the AG's contact at the Arizona Medical Board. Emily wasn't in the room when they arrived, but Strickland found her in Bay 8 where she was helping the afternoon nurse, a younger woman named Gretchen who was 2 months into her ICU rotation and who had been quietly overwhelmed by the activity in the unit all day without saying so. Emily had noticed. She'd been working the clinical side of her shift alongside everything else because the patients didn't stop requiring care, because an investigation had opened, and Gretchen needed backup she wasn't going to ask for. She came out of Bay 8 when Strickland appeared. She read the summary he handed her standing in the corridor. The Phoenix facility. 7 years ago. A complaint filed by a pharmacist named Daria Wills, alleging that a senior physician had been using the override system to circumvent high-alert medication approvals. The complaint had been reviewed by the credentialing committee. The reviewing physician on the committee had been a colleague of Kane's who had trained with him at the same program. The complaint had been dismissed. Daria Wills had resigned 4 months later. Her resignation letter, which the Arizona Medical Board had on file, said she was leaving to pursue other opportunities and contained no reference to the complaint. But attached to the board's file, added by a board administrator 8 months after Wills left, as a notational update, was a single line. Former complainant contacted board August 14th to report receiving settlement offer from facility counsel. Amount undisclosed. Board notes no jurisdiction over private settlement from the facility. 8 months after the complaint was dismissed, Emily handed the summary back to Strickland. "That's 2 facilities," she said. "Same pattern." "The Albuquerque files are still coming," Strickland said. "They'll have something too." She wasn't guessing. "He's been doing this for a long time, not everywhere, just at the edges, just where it could be managed." She looked at the wall for a second. "He's very good at identifying what can be managed and what can't." "He miscalculated here," Strickland said. "He miscalculated me," she said. "He saw a nurse with no institutional relationships, no obvious allies, and a background that wasn't on any accessible record. He thought I was exactly what I looked like." "What did you look like?" "Someone who could be moved." She turned back toward Bay 8. "I'll be with Gretchen. Tell me when the Albuquerque files arrive." Chat. At 6 p.m., Margaret Voss called a mandatory senior staff meeting on the 4th floor conference room. The call went to department heads, division chiefs, and the board's chair, who had been notified by Voss at 2 p.m. and had been on a plane from Boston since 3. Kane was not present. He had not been in the building since 5:15 the previous evening, and his administrative privileges had been suspended that morning. His parking card had been deactivated at 9 a.m., a detail Emily knew because the security desk had processed it while she was passing through the lobby, and the officer on duty had mentioned it to the person behind her with the incautious candor that people at security desks sometimes displayed. Nicole was present at the senior staff meeting. Emily knew this because Marcus, who had an unnerving radar for information flow in the building, told her within 4 minutes of Nicole entering the conference room. Marcus was not surveilling deliberately. He was just always there and always paying attention, and had long since developed the ICU's collective situational awareness as a kind of ambient sense. "She looked like she hadn't slept," Marcus said. "She probably hasn't." Emily was reviewing the overnight assignments. "Stay on your section, Marcus." "I'm just saying." "I know what you're saying. Go check Bay 5's output." He went. The board chair arrived at 6:40 and went directly to the 4th floor. Emily saw him briefly in the lobby. A man in his late 60s named Warren Chu. Heavy coat, no luggage, because he'd come in a carry-on, someone who traveled the way people travel when they'd done it enough that efficiency was automatic. He moved through the lobby with the purposefulness of someone who knew what he was walking into and had already decided what he thought about it. Whatever was said in that 4th floor meeting, Emily was not part of it. She had her shift. She had Gretchen, who had studied considerably by 6 but was still managing more than her training had prepared her for. She had Bay 3, whose patient had developed a fever she needed to track, and Bay 7, whose patient's family had arrived from out of state and needed a full briefing that the attending had technically ordered but had not yet provided. She provided it. Not because it was her role in the strictest sense, technically the attending was responsible for family conferences, but because the family had been waiting 2 hours and the attending was in the 4th floor meeting and the information was Emily's to give, accurately and completely, which she did, standing in the family consultation room for 22 minutes, answering questions with the directness that frightened some families, and that this family, a mother, a father, and an adult son who was a paramedic and understood clinical language, clearly needed. When she came out, Strickland was waiting by the nurse's station with the Albuquerque files in his hand. She didn't need to read past the 3rd page. Albuquerque, 4 years ago. A nursing supervisor named James Portillo had filed a complaint with the New Mexico Medical Board alleging systematic override abuse and 2 documented cases of chart amendment in the wake of adverse events. The complaint had been filed, investigated, and closed. Portillo had been terminated 8 weeks later for, per the facility's HR documentation, performance deficiencies. He had filed a wrongful termination suit. The suit had settled, confidential terms. 2 facilities, 2 complaints, 2 people removed, 2 settlements. He has a lawyer who specializes in this, Emily said. Not Kane's current attorney. Someone upstream of him. Someone who identifies the complainants and manages them out before the exposure consolidates. She looked at Strickland, who represented the facilities in both settlements. Strickland looked at the files. He found the page. He read the name and then looked up slowly. Same firm, he said. Same firm both times? Hendricks and Vale. Denver-based. He turned the page to show her. Both settlement agreements list them as counsel for the facility. Denver-based. Ironwood's legal counsel, whose representative had been in the room the morning Emily submitted her folder, taking notes at a pace that suggested complicated calculations, was a firm she had not yet identified by name. "What firm does Ironwood use?" she said. Strickland was already on his phone. He found it in 40 seconds. Ironwood's outside legal counsel, per the hospital's publicly filed corporate disclosures, was Hendricks and Vale. The room, not literally, but the space between them, went very still. The same firm that had managed the settlements in Phoenix and Albuquerque. The same firm that had been in the room when Emily's folder landed on the conference table. The same firm that, she now understood, had the institutional relationships at Ironwood that Kane would have needed to ensure that complaints didn't reach the surfaces they were meant to reach. "Strickland," she said. "I know. That's not a conflict, that's a system." "I know," he said again. His voice had changed, flatter, more careful, the voice of someone building a thing in their head that needed to be solid before they spoke it. If Hendricks and Vale has been managing this across multiple facilities and they're currently Ironwood's counsel, then the legal representative who was in the room this morning has a material conflict of interest in any internal investigation. Emily looked at the nurses' station, at the ordinary machinery of the ICU going on around them, and would have had access to everything Voss reviewed today, including the folder. Strickland was calling Halford before she finished the sentence. Emily leaned against the counter. Her left femur was aching. She'd been on her feet for 11 hours. She thought about the legal representative in that room, sitting to Voss's left, taking careful notes. The pace of the notes. The specific things he'd written down and the specific things he hadn't. She thought about Kane's attorney filing the nursing board complaint at 6:53 a.m., faster than it should have been possible to draft and file a formal complaint, as if the language had already been prepared, as if the contingency had been anticipated in advance by someone who knew the investigation was coming before Kane did. The legal representative had left the building at, she thought back, placed him in the lobby at approximately 3 p.m., 2 hours before the AG's office had made their second call to Voss, before Voss would have had reason to know how serious the afternoon was becoming. But Kane's attorney had filed at 6:53 a.m., before Voss came into the hallway, before most of the day's events. The representative had been in the room when she'd submitted the folder the previous morning, 12 hours before the nursing board filing. She had handed the folder across the table and said, "I'm available whenever," and the representative had been looking at it when she left the room. He had called someone, not on behalf of Ironwood, on behalf of someone he'd been protecting for considerably longer than Ironwood's engagement with his firm. She was still thinking through the implications of this when her phone buzzed. Not Strickland's line, her personal phone, the one only a specific set of people had the number for. It was Damon Reyes. She answered it. "You should be sleeping." "There's a man," he said. His voice was controlled in the way it got when he was managing something. "He came to my room about 20 minutes ago. Said he was from hospital administration. He asked me questions about the night I was admitted, specifically about who I'd spoken to and what I'd said about the nurse on duty." A pause. I didn't answer him. But he had a badge. It had the right logo. And I've seen enough people try to cover their tracks to know what that conversation was. Emily straightened. "What did he look like?" she said. Reyes described him in the efficient way of someone trained to observe and report. Medium height, 60s, gray suit, no hospital ID lanyard, just a badge clipped to his breast pocket, which was not standard procedure for administration, which hung their IDs on lanyards universally. A badge clipped to a breast pocket. She knew who it was before he finished the description. "Reyes," she said. "Don't speak to him again. Not a single word. If he comes back, call me and don't hang up." "Copy." She ended the call. The legal representative from Hendricks and Vale had gone to Damon Reyes's room. Had gone to the patient, the one whose call had started all of this, the one whose testimony would corroborate Emily's account of the night of the arrest and the sequence of events that followed. Had gone to him without Voss's knowledge, after the AG's investigation was open, after the Joint Commission site visitor was in the building, and had asked him questions about what he'd said and who he'd spoken to. That was not legal counsel managing a hospital's liability. That was witness interference. Emily walked to the nurse's station, pulled up the visitor log for the patient floors on the terminal, and found the entry she was looking for. Bay 6, Reyes D. Visitor Check-in, 5:47 p.m. Logged name, Administrative Services, Voss M. He had checked in under Voss's name. She photographed the screen with her phone. Then she called Strickland back and said simply, "Get Halford and come to the ICU, right now. And call whoever you need to call to have a man detained before he reaches the parking structure." Strickland said, "Emily, his name is on Ironwood's outside council engagement letter," she said. "He just went to Reyes and logged in under Voss's name. He's going to try to leave the building." She was already walking toward the elevator bay. "I need him in a room before he does." The elevator across the hall opened. The man in the gray suit stepped out, badge clipped to his breast pocket, and found Emily Carter standing 12 feet away in the middle of the corridor, looking directly at him with an expression that contained no particular anger and no particular urgency. Just the flat, absolute, and entirely unhurried look of someone who had been waiting for a door to open and had positioned herself correctly and had nowhere else she needed to be. He stopped. The elevator doors closed behind him. For a moment, neither of them moved. Then, from behind Emily, she heard the stairwell door open and Halford's voice, very calm, very final, saying, "Mr. Hartwell, don't go anywhere." The man in the gray suit looked past Emily at Halford. He looked at the two officers behind Halford. He looked at Strickland, who had his phone out and was already on a call Emily could tell was not casual. He looked back at Emily, and she saw it. The specific, precise moment when a person who has spent years managing situations recognizes that they are inside one they cannot manage. It moved across his face the way weather moved, there and then controlled, but not before she'd seen it. "I'd like to call my attorney," he said. "You are an attorney," Emily said. He said nothing. "Mr. Hartwell," Halford said again from behind her, "we have questions about your visit to a patient room this evening and about your firm's engagement history with two prior medical facilities where a Dr. Victor Kane previously held privileges." He had come to stand beside Emily now. "You're going to want to stay." Down the corridor, in Bay 6, the light was on, and in the fourth-floor conference room where Margaret Voss had been running a senior staff meeting for the past hour with a firm's representative she'd trusted for 11 years, her phone lit up with a text from Warren Chu that read, "Stop the meeting, come to my office, and don't bring legal counsel." Voss read Warren Chu's text once, stood up from the head of the conference table, and said to the room, "We'll continue this tomorrow," in the tone that left no space for questions. She was in Chu's office 4 minutes later. Chu was behind his desk with his coat still on, which told her he hadn't planned to stay long, and the expression on his face told her that whatever he was about to say had already been decided before she walked through the door. Chu had been chair of Ironwood's board for 6 years. He was not a man who summoned people to deliver uncertainty. "Hendricks and Vale is conflicted out," he said, "effective immediately. I've already called the engagement contact." Voss sat down. "Warren, their representative went to a patient room this evening and logged in under your name." He said it without heat, but the fact of it sat between them like something that needed to be looked at directly. "Whatever else is happening in this building, that is a problem I am not going to manage around. If their client is Kane and they've been covering his record across multiple facilities, then every piece of legal advice they've given this institution in the last 8 years needs to be reviewed for conflict." Voss was quiet. "How much did you know?" Chu said. "Not accusatorially, The way you ask someone something when you need an accurate answer more than you need a comfortable one. She thought about Patricia Solano's complaint, which she had received a summary of in March and had passed to the risk management office, which was overseen by a department head who reported to the CMO, who was Kane's peer and longtime colleague. She thought about the summary she'd received back. Matter reviewed, no action indicated. She had accepted it. She had moved on. She had not followed up. Not enough, she said. I should have followed up on Solano's complaint myself. I didn't. Chu looked at her for a long moment. We're going to need an independent external review of every incident report from the past 8 years that was marked closed. Everything that touched Kane's division. I know. And Carter's documentation, the folder she submitted, and whatever she gave the JAG officer, that becomes the baseline, not the thing we're responding to. He finally took his coat off, which meant he was staying. She built this case inside our building for 14 months and nobody saw it. I want to understand how that happens. She's very good, Voss said. It came out simpler than she'd intended and truer. Yes, Chu said. She is. Immersive. By 8 p.m., Howard Hartwell of Hendricks and Vale was in a fourth-floor administrative office with 2 federal investigators from the Department of Health and Human Services and Strickland, who had stopped taking notes because he was recording. Hartwell had called his own attorney, a separate attorney, not from his firm, and that attorney had arrived at 7:40 and had spoken to Hartwell privately for 8 minutes before coming out and informing the investigators that his client would be providing a full statement. Full statements, in Emily's experience, never meant full. They meant the portion a person had calculated they could not protect. But they also meant the portion was coming, and the portion always contained more than the person giving it intended. She wasn't in the room. She didn't need to be. Strickland would send her the relevant sections when they were processed, and she had a shift to finish. Bay 3's fever had broken at 7:30, which was good, but the source was still unclear, which wasn't. She flagged it for the night attending with a detailed note that laid out the 3 most likely differentials and the testing that would confirm or rule out each one. The attending, a steady woman named Dr. Priya Mehta, who had been at Ironwood for 3 years and who Emily had always found rigorous and easy to communicate with, read the note, nodded, and ordered 2 of the 3 tests Emily had listed. Good catch on the trend, Mehta said. It was there in the 6 o'clock vitals. I saw it. Mehta looked at her. I also saw the folder you submitted. I wasn't in the chain on any of those incidents, but she paused, choosing the construction carefully. Some of what's in there was visible to people who should have acted on it. I'm sorry they didn't. Emily met her eyes. Thank you for the tests. She meant it, not as a deflection, as an answer. The tests were what mattered right now, for the patient in Bay 3, and Mehta had ordered them, and that was the job. At 9:15 p.m., Marcus appeared at the entrance to Bay 8, where Emily was doing a final check on her last patient of the shift, an 81-year-old man named Harold Dietz, who had been admitted after a hip replacement complication and who had, over the past 2 days, developed the habit of asking Emily for updates on things she couldn't tell him about. The investigation, the military officers, whether the nurse who'd been there yesterday would be back. He asked again tonight. You staying? He said. His voice was the particular raspy authority of someone who had spent a long career being listened to and hadn't fully adjusted to the hospital dynamic of being the one asking. Still here, she said. I heard they suspended that doctor, the one who... He stopped. Well, the one. Don't believe everything you hear in a hospital. Heard it from the night orderly and the afternoon tech and the woman from dietary, he said. Seems reliable. She adjusted his blanket. Your hip flexion's improving. That's what you should be focused on. My hip flexion is fine. I want to know if you're staying. He looked at her with the directness of someone who'd run out of patience for indirection somewhere around age 75. This place needs people who actually give a damn. You can tell, after a while, who's doing a job and who actually gives a damn. Emily finished her check. She noted his fluid output. She made the final entry on his chart. Get some sleep, Mr. Dietz, she said. That's not an answer. She looked at him once, briefly, and then she went to find Marcus. Marcus had a look on his face she hadn't seen from him before. Not the ambient alertness he usually wore, but something more deliberate, like he'd been holding something and had decided it was time to put it down. "I need to say something," he said. "Okay." "The night Reyes coded, I started compressions because you told me to." He said it straight, not as preamble. "I wasn't going to on my own. I was waiting to see what Nicole said and what the resident did, and I was going to follow whoever moved first." He looked at the floor for half a second, then back up. "You moved, so I moved." Emily looked at him. "I also didn't correct the incident report," he said. "When it went around and people were talking about it, as if you'd done something wrong, I didn't say anything." "Marcus." I know it doesn't. It's done," she said. "You did your job when it counted, and you're doing it now." She held his gaze. "That's what I want from you. Not perfect, just consistent." He nodded. He looked like he wanted to say more and was deciding, correctly, that he didn't need to. She went to do her handoff. The handoff took 19 minutes because she was thorough and she didn't shortchange it because the day had been complicated. The night nurse was a man named Theo who had worked the ICU for 6 years and who received information at the pace and depth it was given. And when Emily was done, he said, "Long one," and she said, "They all are." And that was the end of it. She was in the locker room at 9:58 p.m., changing, when Halford knocked on the open door. Knocked, waited, which she noted. "Decent time to talk?" he said. "Yes." He came in. He stood the way he stood everywhere, without leaning, without occupying more space than he needed. He had his cap off. His rank was less visible without it. Hartwell gave a partial statement, he said. Enough. He confirmed the firm's engagement across 3 facilities, confirmed Kane was a client of the firm in a personal capacity, not just through the facilities, and confirmed that the nursing board complaint this morning was drafted by a paralegal in their office before the folder had even been fully reviewed. He paused. He says it was Kane's direction. His attorney is already building the argument that his client was acting on client instruction. Whether that holds or not, there's enough in the statement to refer the firm to the Colorado Bar for review. Emily pulled on her jacket. Kane's hospital privileges are suspended indefinitely pending the internal review, Halford continued. The AG's office confirmed they're pursuing formal charges. Pharmaceutical fraud, the override records Solano submitted, combined with the video, gives them the pattern. Depending on what comes out of the Phoenix and Albuquerque files, they may be looking at a broader conspiracy charge. And Hartwell? Bar review at minimum. The HHS investigators are looking at whether the settlement agreements in the prior facilities constituted obstruction. That takes time. He looked at her. These things take time. I know, she said. Nicole Parker's been placed on administrative leave pending review of the Solano email and her supervisory decisions in the relevant period. The review is expected to result in removal from the charge role. Whether she retains her nursing position depends on the findings. Emily processed this. Nicole had not been the architect, but she had been a wall that things had bounced off of for a long time, and even walls that didn't mean to hold things in still held things in. Ryan Foster, she said. The residency program director has been notified of his formal correction to the incident report. It's been reviewed positively. His attending evaluation isn't something we have jurisdiction over, but... Halford stopped. The chief of medicine, who is not Kane, received a copy. I'm told Foster's evaluation will reflect the correction. She nodded. Emily. Halford's voice shifted slightly. Not softer exactly, but less formal. The register he used when he was saying something that wasn't organizational. The DSM ceremony is scheduled for the 14th. 3 weeks. He set a manila envelope on the bench beside her. Orders for the reassessment process are in there, if you want to pursue reinstatement. The advisory role offers are in there too. You don't have to decide anything tonight. You don't have to decide anything by the 14th. She looked at the envelope. But I want to be honest with you, he said. What you built here, the documentation, the approach, the patience of it, that's not something we trained you to do. We trained you for the field. You applied it to something completely different, and you did it for 14 months without institutional support or recognition. He paused. That kind of operational discipline is not common. And I'm not going to pretend we wouldn't like to have it working in a capacity where it has more support behind it. I'll read the envelope, she said. That's all I'm asking. She picked it up. She put it in her bag. She zipped her bag. Richard, the first time she'd used his name. He registered it without reacting. The people who got removed, Solano, Portillo, the nurse in Colorado, are they going to be contacted as part of the process? The AG's office will need statements from them. They'll be contacted. Make sure someone explains what's happening before the official contact comes. They've been managed out of systems before. An official contact without context is going to feel like the same pattern. She met his eyes. They deserve to know why they're being called. He held her gaze. I'll make sure of it. She left the building at 10:22 p.m. The next 18 days moved in two distinct registers simultaneously. In the first register, things moved slowly. The formal investigative process, the board review, the bar referral for Hendricks and Vale, the coordination between the Colorado AG's office and the HHS Fraud Division, and the Army Inspector General's concurrent review of Emily's separation file. These things had their own calendars and their own bureaucratic gravity, and nobody who understood how they worked expected them to be quick. In the second register, things moved very fast. Victor Kane's hospital privileges, suspended on day 1, were formally terminated on day 6 after the Internal Review Committee completed its preliminary findings. Findings that included the authenticated video, Solano's 74 archived records, Ryan Foster's written correction, and a pattern analysis of Kane's incident reporting history that the external reviewer, a former Joint Commission investigator, described in his preliminary report as consistent with systematic concealment over a multi-year period. Kane's medical license was placed under emergency suspension by the Colorado Medical Board on day 9, pending formal hearing. The board's press office released a statement that used the phrase patient safety emergency twice, which was not language they used often or lightly. The AG's formal indictment came on day 14, the same day as the DSM ceremony, and contained 7 counts, including pharmaceutical fraud, falsification of medical records, and obstruction of a patient safety investigation. It named Kane. It named Hartwell. It named the firm in a civil referral that was separate from but parallel to Hartwell's personal exposure. The indictment was public record the moment it was filed. It appeared on the Denver News Wire at 11:47 a.m. By 2 p.m., it had been picked up by 3 national health industry publications. By 6 p.m., it had a segment on a cable news program that Emily did not watch because she was in a dress uniform she'd last worn 6 years ago, let out slightly at the shoulders, which had not been necessary 6 years ago, and was now, which was a small human detail she had not expected to notice during the ceremony, but did. The Distinguished Service Medal ceremony was held in a formal room at Buckley Space Force Base, east of Denver. Halford presided. Colonel Adkins read the citation, which was 4 paragraphs, and which Emily listened to with her hands at her sides and her face in the expression she'd spent a long time learning. Present, absorbing, not performing the thing that was being performed around her. The citation described the operation in the province whose name she still couldn't hear without her jaw tightening. It described the 112 minutes. It named Torres, and the 3 others, and the conditions, with the particular factual precision that military citations used because there was no embellishment that could improve what the facts already were. When Halford pinned the medal to her chest, he met her eyes and held them for a moment before stepping back. She didn't cry, not because she was suppressing it, but because what she felt in that moment was not the sharp kind of emotion that produced tears. It was heavier and more complicated than that. The specific feeling of something long owed arriving so late that the person who would have been most changed by it in the moment had already had to find other ways to continue. She was grateful for it. She just received it differently than she might have at 24. Torres was there. She had known he was coming because Halford had told her 2 days before, and she had spent those 2 days deciding whether that was something she wanted and concluding that it was, but that she would need approximately 90 seconds after the ceremony before she could handle it. She got 45. He was waiting off to the side when Halford released the formation, a lean man in his late 20s with a scar along his left jawline that she remembered in a more raw and recent state than its current form. He walked to her and they stood in front of each other, and neither of them said anything for a moment. "Hey, Doc," he said. It was what they'd called her. Not her rank, not her name. "Torres," she said. "How's the lung capacity?" He laughed, a short, surprised sound. "Full function, according to my last assessment." "Good," she said. "That's what I wanted to hear." They talked for 20 minutes, not about the operation, not in any sustained way, not in the way that trauma narrative workshops would have prescribed, with arc and resolution and meaning made explicit. They talked about Fort Bragg and about Denver and about the vehicle accident on I-25 that had brought Damon Reyes to her ICU. And Torres said, "He called me too, before he called his CO. He wanted to know if the description matched. Did it? I told him there was probably only one person in Colorado who decompressed a chest like that." He looked at her. I should have. Don't," she said. "I knew you'd separated. I knew how you'd separated. I should have pushed harder on Torres." She said it the way she'd said things to him when he was bleeding and arguing about whether the IV was necessary. The voice that meant stop and listen. "You were processing your own separation, your own stuff. You didn't owe me a search." "I could have, but you didn't, and here we are anyway." She looked at him steadily. "Here we both are." He closed his mouth. He nodded once. "Stay in touch," she said. "Copy," he said. And then, quietly, the way he'd probably said it more times than she knew, "Thank you." She did not tell him he was welcome because that particular transaction had always felt unbalanced to her. She'd done what she'd done because the alternative was not who she was, and you didn't accept thanks for being yourself. She just said, "Take care of yourself," and meant it completely. She was back at Ironwood the next morning at 6:53 a.m. This was noted, not by her, she didn't keep track of being noted, but it was noted. By Marcus, who saw her come through the side entrance and made a sound that was not quite a laugh. By Gretchen, who had become considerably more confident in the 2.5 weeks of the investigation, and who nodded at her from the nurse's station with the brief, direct respect of one professional acknowledging another. By Dr. Priya Mehta, who was finishing a night shift and paused in the doorway of the medroom and said, "Good to see you back," and meant it in the uncomplicated way that people who do hard work together mean these things. By Harold Dietz, who was being discharged that morning and who, when Emily came to do his final check and sign off his discharge paperwork, looked at her and said without preamble, "I heard." "You always hear everything, Mr. Dietz. Military ceremony, medal, 14 months of documentation, federal indictment." He ticked them off with the satisfaction of someone who had followed a long story to its conclusion. Not bad for someone who moved bedpans. "I didn't move bedpans." "You know what I mean." She did. "Safe discharge," she said. "Take the physical therapy seriously." "Emily." He said her name the way old men said names when they wanted you to actually stop and receive something. "You give a damn. Don't let them take that from you, no matter what title they put in front of your name." She looked at him. He was 81 and demanding and correct. "Thank you, Mr. Dietz," she said. This time she meant it as a full sentence. But the formal personnel actions came through during her second week back. Nicole Parker was removed from the charge nurse role, effective immediately, and placed in a staff nurse position with a supervised practice period pending the completion of the board review. She would not be terminated. The internal review had concluded that, while her supervisory decisions had contributed to an environment where Kane's conduct went unchallenged, she had not been an active participant in the falsification or the management of complaints. She had been used. That was its own kind of accountability, distinct from the kind that produced termination. Emily saw Nicole on the third morning of her second week back. They were at the same medication station at the same time, a logistical collision that neither of them had arranged. Nicole was in scrubs without the charge badge, and the absence of it was visible in the same way that the absence of any habitual weight is visible in the way a person carries themselves. They worked side by side at the station for approximately 40 seconds without speaking. Then Nicole said, without looking up from what she was doing, "I read the full documentation, all of it, including the Solano files." Emily said nothing. I gave Kane the benefit of the doubt for 8 years, Nicole said. Her voice was flat in the way voices get when a person is being honest about something that costs them. Because he was competent when he needed to be, and he was connected, and I thought the people above me had done the due diligence I didn't have access to do. She paused. That was wrong. I know it was wrong. Nicole, Emily looked at her. The patients you advocated for in 14 months, do you know how many times you stopped a worse outcome by holding the line on something that was nobody's fault? Just the ordinary chaos of a short-staffed ICU? She held her gaze. You're a good nurse. You were a bad manager in a specific way that Kane knew how to exploit. She turned back to the medication station. Don't confuse those two things. Nicole was quiet for a long moment. I didn't think you'd... She started. I'm not forgiving you, Emily said. Not harshly, just accurately. I'm telling you what I observed over 14 months. What you do with it is yours. Nicole nodded. She finished what she was doing. She left without saying anything else. That was fine. Most things didn't need a closing line. Voss called Emily to her office on a Thursday, 3 weeks after the ceremony. The office faced east, same as always. The morning light was better this time. Spring moving in, the particular clarity of Denver at altitude when the winter releases its grip by degrees. The board made a decision yesterday, Voss said. She had the formal quality she always had, but it was running on a different operating system than it had before. Something underneath it had been revised. I want to tell you before you see it posted. Emily waited. The Director of Trauma Operations position has been open since Dr. Henshaw retired in December. The board has authorized me to offer it to you. She held Emily's gaze. It's a senior leadership role. Oversight of trauma protocols, clinical quality standards, staff development in the trauma division. You would have authority to revise the incident reporting structure and reporting chains. She paused. Full authority. Emily looked at the mountain view from the wrong side of the desk. It's not a consolation, Voss said. And I'm not going to pretend this institution behaved well. We failed you and we failed other people, and an external review is going to tell us specifically how for the next 2 years. She paused. But the role is real, and your record here, both the clinical record and the 14 months of documentation, is exactly the foundation this division needs to rebuild on. Emily thought about the envelope from Halford, the reinstatement pathway, the advisory role, the things she could go do elsewhere, in systems that had not spent 14 months making her carry the worst assignments while a man with a cover-up on his record moved 3 floors above her. She thought about Harold Dietz. Don't let them take that from you, no matter what title they put in front of your name. She thought about Bay 3's fever, and Gretchen steadying over 2 weeks, and Theo receiving a thorough handoff without needing to be told why it mattered, and Priya Mehta ordering the right tests because she trusted the nursing note. She thought about Patricia Solano, who had pulled archived logs before she transferred and kept them for 8 months because she'd known that eventually someone would need them, and about James Portillo in Albuquerque, who had filed his complaint and lost his job and filed his suit and settled and still, the records showed, called the New Mexico board 18 months later to follow up. People who couldn't let it go because they'd seen something wrong and the machinery of their conscience didn't have an off switch. She thought about what this building needed and who would do it if she didn't. I want full authority over the reporting chain, she said, not advisory authority, decision authority. That's what the offer includes. I want Patricia Solano offered a position here, qualified role, fair compensation. She's been at Presbyterian for 6 months, and she left a situation that was not her failure, Voss considered. I'll put it forward to HR. And I want the ICU staffing reviewed. Actual ratio analysis, not the model ratio. What the floor actually runs on. She looked at Voss directly. The burnout that makes nurses stop flagging things doesn't come from nowhere. It comes from 12 hours of being understaffed and being told the numbers look fine. That's a budget conversation. I know. I'm prepared to have it. Voss held her gaze for a long moment. There was something in her expression that was not quite respect and not quite regret, and was actually both of those things occupying the same space. Do you want the position? She said. Emily looked out the window. Denver at altitude, spring light, The mountains clear and enormous and indifferent in the way that large things are indifferent, not cruel, just unscaled to human problems. Yes, she said. The last thing that happened was small, in the way that the things that stay with you are often small. She was in the ICU the following Tuesday, her first week in the new role, wearing the same scrubs she'd always worn because the role didn't come with different clothes, doing the rounds she'd always done because patient care didn't reorganize itself around titles. She had a meeting at 2 p.m. with the staffing committee and a protocol review scheduled for Thursday, and a call with Patricia Solano set for Friday about whether she'd consider coming back. She was at the nurse's station, reviewing a chart, when she heard footsteps behind her and turned. Damon Reyes was standing at the entrance to the ICU in jeans and a jacket, moving with the careful gait of someone whose chest wall still remembered a chest tube, which it would for a while. He had his discharge paperwork in his hand for no reason she could identify except maybe habit, the way people carry things they don't need when they're going somewhere that mattered. "You didn't have to come back," she said. "I wanted to." He looked around the ICU, the monitors, the bays, the fluorescent light that was the same light it always was. "Looks different when you're not dying in it." "Most things do." He looked at her. The expression was the same one he'd had in Bay 6, the look of someone trying to categorize something they'd encountered before, but never quite this directly. "How's the new job?" he said. "It's the same job," she said. "The paperwork's different." He almost smiled, the same almost smile from Bay 6 weeks ago when she'd told him the answer was implicit. "Torres says hi. Tell him to keep up with the physical therapy." "He said you'd say that?" He was quiet for a moment. "I wanted to. I don't know what the right thing to say is." "You don't really want to be thanked." "No," she said. "But you should know," he said, "that what you did, not just for me, not just the needle thing, all of it, it mattered. The whole thing mattered." He looked down at the discharge papers in his hand and then back up. There were people in this building who were going to keep getting hurt, and there were people in other buildings who already had been hurt, and the thing that stopped it was one person who decided to pay attention for 14 months and not break. He held her gaze. "That was you." Emily stood in the middle of the ICU she had spent 14 months protecting before anyone knew she was protecting it. The monitors beeped their ordinary rhythms. The overhead light was the same light it always was. "Go home, Corporal," she said. "Recover properly." He nodded. He turned to go. Then he stopped and he came back, and without asking, she would have said no if he'd asked. He brought his right hand to his temple in a clean, brief, precise salute. She looked at him. 22 years old, alive, she raised her hand and returned it. He left. She turned back to the chart. The ICU went on the way I see us. Go on. Without pause, without acknowledgement, without ceremony. Bay 2 needed a pressure check. Bay 5's labs were back. Gretchen had a question about a handoff she was managing, and Emily moved toward her to answer it, the same way she had always moved. Without wasted motion, without hesitation, without waiting for anyone to tell her she was allowed. She had never waited for anyone to tell her she was allowed. That was the thing nobody had understood. Not Kane, not Nicole, not anyone who had handed her a mop or an incident report or a bad assignment and expected her to fold. You couldn't humble someone who had already decided where they stood. You could inconvenience them. You could exhaust them. You could make their days harder and their nights longer and their documentation thicker. But you couldn't move them. The nurse they had treated like nothing had been carrying everything all along. And the people who had built their positions on the assumption that no one was watching had been wrong. About her, about how long she would wait, and about what happens when the person you dismissed turns out to have been the most capable person in the room every single day you were underestimating her. Some people spend their lives waiting to be recognized before they act. Emily Carter had spent hers acting and let the recognition find her when it did. It found her. She had been right where she said she was.